Hi, my name is Chris Blackman. I'm a general orthopedic surgeon here at Piedmont Orthopedics in Greensboro. I went into orthopedics mainly to help people in terms of their function and their bodies and how they get along with their daily lives. A lot of people either break things or they have joints that hurt. And what I found from an orthopedic standpoint of things is that we can help people improve on their lives by either fixing their broken bones, replacing their joints, performing arthroscopic surgery on a joint to help them get over whatever has been hurt to be able to get back to whatever sport, line of work, or anything else that they do to feel better. I think from an orthopedic standpoint, sometimes patients are surprised to know that we can take care of their kids all the way up to their grandparents. Whether it's an infant with an injury, we can take care of that. If someone has carpal tunnel problems, it's not just a neurosurgeon that can take care of that. Orthopedic surgeons and hand surgeons take care of carpal tunnel syndrome. We can see people for their backs. We can see people for their hips and their knees and their joints. And also other diseases as it relates to not just surgery. Orthopedics, our name is orthopedic surgeon, but that doesn't mean that all we want to do is take somebody to operate on them. To me, it's very satisfying to not take someone to the OR in the operating room if you can figure out, hey, this is something that we can do for you, whether it's an injection or a medication or something else like physical therapy that can help them out other than just, hey, you're coming to see me because I'm going to operate on you. That is very satisfying to me when we're able to do that. And I think it's surprising for a patient when they're sent to us and they think, oh gosh, I'm going to see the orthopedic surgeon with that keyword surgeon, that they're going to operate. And it's nice to be able to say, hey, I don't just operate. There is a medical or a medicine component of being a doctor and being an orthopedic surgeon where you can help somebody out from that standpoint without just operating on them. From an orthopedic standpoint, for me, I've gotten into what's called direct anterior hip replacement surgery. Joint replacements have been done for years, and even anterior hip replacements have been done, but they're not done frequently or often because it's been difficult in terms of instrumentation, operating room tables, and the difficulty in getting into the front of the hip. We always hear we're a product of our training. Most people come through their residency and their training to become an orthopedic surgeon learning the posterior hip surgery. When I came through my training, I was learning a different approach called an anterior lateral. When anterior hip replacement was becoming more and more popular, I decided for myself, well, gosh, that's something that I would want to learn how to do. And you could always, any kind of medical profession is about learning, and you constantly have to stay on the forefront and learn. And so I decided, well, this is something I want to learn to do. So I went around the country to special courses, met with other surgeons, even scrubbed in or got into the operating room with different surgeons to learn how to do this new approach. And now I've incorporated this into my practice in Greensboro. It took me going to the hospital and saying, hey, this is something I think will help my patient population recover better from the surgeries that I was doing before. And so they were receptive to that because they, I think, see that, hey, this may be a trend that is becoming more and more popular. You see it on the internet, you see it in your daily lives, and you hear about it from other people. And even friends of mine from around the country that were doing this surgery said, hey, you need to think about this. So I started doing this surgery, anterior hip replacement, about 2 years ago. And what I found from it is, yes, my patients are better in my patient population than what I've done before. I'm getting them out of the hospital quicker. I'm getting them able to do activities of daily living or other functions, or even getting back to sports quicker than what would be done through a traditional approach to surgery. And it's been very satisfying, very gratifying. It's my favorite surgery to do, mainly because I've taken something that I used to do and I've built upon it and made it better. And I've seen that in my patients. They're walking quicker, they're getting back to work quicker. I'm letting them drive as soon as they want to drive. I have no precautions. Sometimes you hear about hip replacement surgery and someone can't bend over certain ways for an amount of time because their hip may pop out of place. With direct anterior hip replacement surgery, that's much less likely to occur. The dislocation rate is almost essentially none. It can happen. I mean, obviously anything can go wrong with surgeries, but it's less likely. And what I've seen from that surgery over the last 2 years is that patients are doing better and better. And now I get patients coming to me specifically to ask for that approach. They've maybe seen somebody else and they've then gotten on the internet and said, hey, I've learned about this on the internet and then I saw that you do this surgery. Tell me about it.